morning, everyone. Pleased to be here with Minister Copping and Dr. Sid Viner from Alberta Health Services at the Cal Wenzel Precision Health Center at the Calgary's Foothills Hospital, to provide an update on surgical wait times in Alberta and an expansion of the Alberta Surgical Initiative to reduce those wait times. We recently shared the very good news that we're seeing a significant increase in cancer surgeries performed in Alberta. So much so that we're even exceeding pre-pandemic numbers in terms of cancer surgeries performed in Alberta. We're running at nearly 115%, in fact. I'm also pleased to say that more cancer patients are getting their surgeries within the clinically recommended time. About 70% are now getting their cancer surgery in that clinically recommended period, compared to 60% prior to the pandemic. So despite the disruption of the pandemic, which all across the world caused surgical cancellations and longer wait times, we are now seeing actually that Alberta Health Services is delivering more and faster cancer surgeries than prior to the pandemic. The surge in cancer procedures is an important accomplishment that's worth celebrating. I'd like to thank all of those working hard, surgeons and medical teams, and right throughout the system and across the province. I'd like to thank all of them, including those here at the Foothills Hospital, the Tom Baker Cancer Centre, and other health facilities around the province for working hard to deliver more surgeries and reduce those wait times. Cancer surgeries were prioritized throughout the pandemic to make sure that those who have the most urgent need would get the fastest care. So it was expected the cancer surgery volumes would recover faster than the overall surgical wait times in Alberta. But we're making progress across the board. We've been steadily increasing surgery capacity, and we are getting closer to pre-pandemic levels for the total surgical wait list. We are doing everything possible to increase capacity in Alberta's healthcare system, including providing more surgeries to Albertans when and where they need them. In this year's provincial budget, we announced that 50 new intensive care unit beds would be open across the province over the next 3 years, the largest one-time increase in baseline ICU capacity in the province's history. I'm pleased to report that 32 of those 50 beds are now open and fully staffed, and more will open this fall as additional staff are hired. We're adding more resources to EMS, including a $64 million increase for EMS in this year's budget, and those funds are supporting more ambulances and more EMS staff on our streets. We're doing more MRI and CT scans than we were doing before the pandemic, and doing more of the urgent ones within the recommended timeframes. And we're adding capacity in continuing care. That's seniors, residences, and care homes. 1 million more hours of home care this year to help keep patients out of hospitals, and 1,500 more continuing care beds this year alone. So patients are actually getting placed into continuing care from hospital in less time than before the pandemic. But apart from the strains on the system from COVID, surgery wait times remain one of the biggest issues in Alberta's health system. We campaign clearly on reducing them, and we are delivering on that commitment. In April of this year, we announced that we are funding 7,000 more cataract surgeries this year, an increase of 25%. The new procedures are publicly funded and performed in privately operated chartered facilities using an approach that is a proven success. It's already enabled us to cut the wait times for cataract surgery nearly in half, from 19 weeks in 2020 to 10 weeks last year. That's shorter than at any time under, for example, the previous government, in fact, shorter than any time since 2015. So if anybody tries to argue that contracting out publicly insured surgeries to privately operated clinics is risky or unproven, let's be clear, the data says the opposite is true. We contract out surgeries because doing that means we get more surgeries done more quickly, all of them publicly insured. And that's why we're moving forward with our surgical plan that we ran on, in addition to adding capacity in our public hospitals, because it's good for patients and it helps us deliver on the need to provide faster publicly funded care. In June, I had the great honor of announcing, together with the Enoch Cree First Nation, that a new chartered surgical facility will be opened on First Nation land. I think it's a first in Canadian history. And it will offer about 3,000 publicly funded hip and knee replacements and other joint procedures in the Edmonton area each year once construction is complete. And I'm here today to announce that we are expanding surgery access in communities in central and southern Alberta as well. Alberta Health Services is today issuing 2 requests for proposals for the south and central zones, seeking chartered surgical facilities, those are privately operated facilities, which can provide several types of publicly insured procedures in these regions. Minister of Health Jason Kenney will provide more details in a minute, but let me just say that using chartered surgical facilities is a key part of boosting our overall surgical capacity and bringing down wait times. They did this very successfully in Saskatchewan, and this is a key part of our strategy. We're also adding surgical capacity at hospitals, as I've said, here in Calgary and across Alberta. But the fact remains that more than 70,000 Albertans are waiting for their surgeries, and more than half are waiting longer than the clinically recommended period, and that is simply unacceptable. We owe it to everyone who is waiting with anxiety, many waiting in pain and discomfort, some who have put their lives on hold to fix this. Of course, the situation we inherited some of the longest surgical wait times in the country in 2019, despite the most expensive healthcare system in the country in per capita terms. And that's why we were determined to harness the innovation and the efficiency, the additional capacity of the private sector in delivering publicly insured surgical care. The bottom line is this, that we must get more patients treated more quickly, and using in the innovation of the private sector is one important tool to do so. You know, the problem with surgical wait times growing is true right across Canada, from BC and Saskatchewan to Ontario and Quebec. In fact, a recent University of Toronto report, in part co-authored by former BC Premier Gordon Campbell, recommended that Ontario learn from the experiences of Alberta and other provinces that are using more broadly chartered surgical facilities to provide surge capacity and to reduce wait times. Here in Alberta, these facilities have actually been operating publicly funded surgeries since the 1990s. In fact, in 2018, before this government launched the Alberta Surgical Initiative, which we're expanding today, about 13% of surgeries performed in the province were performed at chartered facilities, privately operated facilities. That was about 40,000 surgeries a year. We have been able to increase the number of those surgeries to more than 55,000. And we are on track with today's announcement to achieve our goal of more than doubling the number of surgeries performed in chartered facilities. So this is good news for patients who are waiting. And with that, I'd like to invite Minister Kenney to offer more details on this announcement.
Thank you, Premier, and good morning, everyone. Thank you to AHS and the University of Calgary for having us here on the Foothills Medical Campus, and welcome to the Riding of Calgary Varsity, everyone. I'd like to start first off by thanking healthcare workers and physicians for your dedication over the past very difficult 2.5 years. In spite the strains we've had in the system, you provided excellent care to Alberta patients. So for that, I, and on behalf of the Government of Alberta, thank you. And thank you for making it possible to extend the hours of operating rooms at this and other hospitals in the province. Because of your efforts, more Albertans can get their surgeries sooner. We're working hard to continue to increase the number of surgeries through a number of initiatives and investments, a number of them already mentioned by the Premier. First, we're expanding and building new operating rooms in hospitals across the province, including in Calgary, Edmonton, Edson, Grand Prairie, Lethbridge, Medicine Hat, and Rocky Mountain House. We've provided more funding for the project here at the Foothills campus to add 11 new operating rooms and 17 additional recovery beds. Once construction is complete, the hospital will be able to do up to 7,000 more surgeries each year. That includes cancer, spine, and cardiac surgeries where the need is greatest. But we need to do more than just add capacity. We need to manage the whole process better, from diagnosis to recovery and rehab. And we need to try new approaches, like a trial that's currently underway in Calgary and Edmonton. It's called the Anesthesia Care Team Model, and it's being implemented in 2 other provinces. It allows a qualified respiratory therapist to manage anesthesia for some cataract procedures, working closely with an anesthetist. That makes it possible for an anesthetist to oversee 2 or 3 procedures, with a respiratory therapist providing anesthesia service in each room. This is just one example of innovation that can help ramp up surgery capacity. We promised Albertans that they would get access to scheduled surgery within the clinically recommended time, and we're working to deliver on that commitment. Chartered surgical facilities have been part of our systems for decades, as mentioned by the Premier, and they're part of our solution to do more surgeries and to reduce wait times. We focus first on increasing capacity in Calgary and Edmonton. That's because 2/3 of all scheduled surgeries are performed in these 2 cities. We also looked at the type of surgeries where people are waiting the longest, such as knee and hip procedures and eye surgeries. More than half the patients in those areas are waiting longer than the clinically recommended time. Through requests for proposals issued last year for chartered surgical facilities in Calgary and Edmonton, AHS is targeting about 30,000 ophthalmology surgeries in these facilities this fiscal year. They're also finalizing contracts targeting about 6,000 orthopedic surgeries in chartered surgical facilities per year. Now we're moving to expand access to surgeries in the central and south zones of the province. That includes Red Deer and other communities in the central zone, and Lethbridge and Medicine Hat in the south zone. Through new contracts, AHS will fund an additional 1,350 surgeries in the central zone and about 1,250 more procedures in the south zone. The surgeries include hip and knee replacements, general surgeries like hernia repairs, and others. This is a step forward in a number of ways. First and foremost, it means patients will get the surgery they need done sooner, and they'll get it closer to home, making the whole process less burdensome. As I've said before, these are publicly funded services provided on the same basis as in a hospital with no charges to the patient. It's the same service you'd get in the hospital from the same surgeons following the same clinical standards. It also has 2 advantages for the health system. It reduces costs, which free up more dollars to invest in doing more surgeries. And it frees up hospital operating rooms to do them with a focus on more complex surgeries that need to get done in a hospital setting. Long wait times for surgery were an issue before COVID in Alberta and, quite frankly, across the entire country. They hurt patients and they hurt confidence in our healthcare system. We've gotten used to accepting them, and quite frankly, we shouldn't. Our system provides great care, but let's just say the obvious. It doesn't matter how good the care is if you can't get access to it. So we're doing something about it. We campaigned on this issue in 2019 on giving every patient their surgery in a clinically appropriate wait time. It sounds simple, but this is an incredibly ambitious goal. We've never done it before as a province, and in fact, no other province has done it. But we set to work to deliver on that promise the day we were elected, and we stand by that promise today. Now, the pandemic has stretched out the timeline, but it's still the right goal and the right objective. And this announcement today is another concrete step towards achieving it. The new contracts will make a real difference to the people in central and south zones, and it's part of our commitment to Albertans, a stronger, publicly funded healthcare system with better access to care. And I'd now like to call upon Sid Viner to speak more in regards to details regarding the RFP, and then we'll take questions thereafter. Thank you.
Hello, everyone. Thank you for inviting me to join today. It's my pleasure to be here today to talk about the work we're doing in partnership with Alberta Health to improve the wait times of Albertans waiting for surgical procedures in our province. We recognize surgical wait times have been top of mind and of significant concern to Albertans. We also recognize there are many questions about what is being done to reduce the surgical wait list. We know timely access to surgeries is important to Albertans. We are dedicated to ensuring Albertans receive surgeries within clinically appropriate targets. Bringing surgical wait times down is a complex and challenging task, particularly given Albertans' aging population and the impact of the pandemic. AHS, in partnership with Alberta Health, developed the Alberta Surgical Initiative, or ASI, a plan focused on improving the patient's surgical journey and aimed at ensuring that all Albertans receive their scheduled surgeries within clinically recommended targets. The focus of the ASI touches all phases of the patient's journey: consulting with their family doctor and being referred to a surgeon, meeting with the surgeon for an assessment, preparation for surgery by the surgeon and surgical team, receiving surgical care, and recovering from surgery and returning to normal life. The ASI reflects input of patient advisors, operational leaders, physicians, surgical teams, quality improvement programs, and primary care partners. Through the ASI, we will continue to provide quality surgical experiences and outcomes for the people of Alberta. Many successes from the ASI have already been achieved. For example, by updating provincial wait lists, including using an autodialer program to confirm surgical status with patients in the Edmonton zone, wait lists in Edmonton zone improved by up to 5.6%. We're expanding this work across other zones over the coming weeks. As mentioned already, operating room hours were increased at main OR surgical suites, including the FMC that we're at today. And over the past few weeks, we've begun implementing a central access and intake model called the Alberta Facilitated Access to Specialized Treatment, or FAST program, which centralizes referrals. This will create an opportunity for Albertans to be able to access the most appropriate surgeon in the quickest time. With initiatives like these and increasing access to surgeries in local communities through requests for proposals for chartered surgical facilities across the province, we are able to continue to improve surgical access and reduce the surgical wait times for Albertans. Working in partnership with Alberta Health, we're moving towards making sure patients and families receive the surgery they need when they need it, according to clinically appropriate targets. I would like to thank all of the teams at HS who are working together to make this happen. We value all of you and your dedication to Albertans. Thank you again for having me here today.
Thank you, Dr. Viner. That concludes the formal portion of today's announcement. We'll now move over to a media Q&A. There is a microphone over beside the cameras there for any in-person questions. When you go to that microphone, please state your name as well as the outlet and who you're directing your question to. And with that, we'll open things up for our first question.
Good morning, Tiffany Roquette from CBC French Radio Canada. And if I can get the Premier in both languages, that would be really good. Just to start on this announcement, 2023 was the target at first to get to all surgery in the appropriate times. Are we going to fail this target, and what's the next target going to be?
We will not achieve the targets that we set in 2019 because of the impact of COVID. As you know, like every jurisdiction in the world, we had to postpone a large number of surgeries through the COVID era. And so it's logistically impossible to both make up for the COVID delays and to also get ahead of, achieve all of our initial targets. But for certain procedures, we will achieve the targets, such as cataracts. And as I've said, in cancer surgeries, we are doing more, better, and faster. But in terms of general surgeries and, for example, knee and hip surgeries, for example, joint surgeries, we're not quite going to hit the targets. And I could perhaps invite Minister Copping or Dr. Viner to provide a little more detail on that. But that's not going to stop us from doing everything we can to both catch up and reduce the wait times as we committed to do with our surgical wait times guarantee. And I think with the huge expansion of the number of chartered surgeries that we are contracting, we will be in a better position than any other Canadian province to get on top of this national problem. Je dirais que nous ne sommes pas dans une position d'atteindre nos objectifs qu'on a publiés en 2019 à cause des retards avec COVID-19, comme tous les pays au monde. Il a fallu que nous annulions dizaines de milliers de surgeries pendant la pandémie. Et à cause de ça, les arriérés pour les surgeries se prolongeaient pour plusieurs procédures pendant les 2 ans de la pandémie. Alors, il y a certaines procédures où nous allons atteindre nos objectifs, par exemple pour les cataractes et pour le cancer. Mais en ce qui concerne la surgerie générale, nous ajoutons plus de ressources, plus de procédures, plus de médecins, plus des hôpitaux privés, mais ça serait logistiquement impossible d'atteindre les objectifs de 2019.
Thanks, Premier. Just to reiterate, we're not going to hit the targets within 4 years, but we are actually making significant progress. And just frame of reference, we had on the waiting list 68,000 pre-COVID. That went as high after the Delta wave is just north of 81,000. We're back down to 73. Our objective this year is to get it not only below the 68,000 pre-COVID, but make a substantive impact. And quite frankly, we are making an impact. When you look at ophthalmology, cataract surgeries, that used to be the category where the highest category of people on the wait list is now dropped down to number 3. So below orthopedic and general surgery is number 3, and it's continuing to drop. And the reason for that is because we leverage chartered surgical facilities to get those numbers down. So this approach is working. Unfortunately, because of COVID, we're not going to be able to get it hit our targets by the end of the next fiscal year. But we have a plan in place to actually get to hit those targets over the next 24 months, within the next 24 months after that, and we will do that.
Do you have a follow-up today?
Yes, unrelated to the announcement, but I would like to hear the Premier on the AISH reindexation. A lot of economists are pretty thinking that it would have been a good idea to reindex to inflation. It would have made a big difference. Trevor Toom saying it would only cost $82 million to increase AISH by 6% this year, which would be the rate of inflation. Why didn't you do it?
Well, Alberta already has by far the most generous support for persons with disabilities. In fact, we are 37% more generous than the next most generous province. So we already provide by far the most generous benefits. AISH is not the only benefit that most of those beneficiaries, first of all, people can have a very generous opportunity to get earned income without that being discounted from their AISH payments. Many individuals also benefit from various forms of social housing and other social benefits, both federal and provincial. We acknowledge that everybody is struggling with the rising cost of living and inflation, higher energy and food costs. We don't want to add fuel to the fire of inflation, as some governments are doing, by just spending more and more. In fact, it is irresponsible government fiscal policies that are partly the cause of the 40-year high inflation that we are experiencing right now. So we had some very serious discussions about options, and we decided, look, we had made a clear commitment to re-index the tax brackets as soon as the province's finances were stabilized, but we don't want to get too far ahead of our skis. You saw that yesterday oil prices declined again. A few weeks ago, oil was at $120. Today it's trading at $85. And our premise for a balanced budget is based on $70 oil. So we can't make the mistake of the past of jacking up our spending across the board based on some temporary high oil prices. So we have to continue to exercise caution. That and indexation of some other programs is always an option for government if the fiscal situation continues in a positive direction. You want that in French or a little version of that? Écoutez, l'Alberta a déjà les paiements les plus généreux au Canada. En ce qui concerne les personnes handicapées, c'est 37% plus généreux que la Colombie-Britannique, par exemple. Et nous avons plusieurs autres programmes sociaux dont les gens profitent. Je sais très bien que les gens ont difficulté avec l'augmentation du coût de vie, avec l'inflation. Mais cela étant dit, c'était les politiques fiscales irresponsables de plusieurs gouvernements qui est une des causes de cette inflation. Et nous avons décidé comme gouvernement de ne pas ajouter à cette pression fiscale qui a mené vers l'inflation. Mais et il faut être prudent au plan fiscal parce que ça fait quelques semaines, le prix du pétrole était $120. Aujourd'hui, c'est $85. Et ça peut continuer à diminuer. Rappelez-vous que le plan pour un budget équilibré était basé sur un prix de pétrole de $70. Alors, il faut être prudent, mais c'est toujours une option pour les gouvernements à l'avenir.
Hi, Colleen Underwood, CBC. I actually had a question about the announcement. Just to explain exactly, first of all, these additional surgeries in the Central and South, is that per year? And how will that impact your goals?
So I'll start off, and then I'll ask Dr. Viner to jump in
Yeah,
as well.
please do, 'cause I
So
just
the
like
answer
that.
is yes, it is per year. So that's the additional surgeries that we're actually contracting for. And that's in multiple categories, so including orthopedic and general surgeries. And what that's going to do is add capacity to the entire system. So not only does it take surgeries out of currently that's being performed in the Red Deer Hospital and other hospitals in the central area, and puts them in a chartered surgical facility, so that you get the double bang for the buck. So then you open up capacity there for more complicated surgeries that can be done within the hospitals and increase the entire capacity. One of the challenges, of course, is and this is why we talked to about the anesthesiology and the availability of anesthetists in terms of that program, so we can actually do more with the same amount of people. So we continue to focus on staffing to make sure that we can support this plan, and then this will actually be able to, it's not quite a 2-for-1 because it takes longer to do in the hospital some of the more complex surgeries, but it does free up additional capacity. But Dr. Viner, if you want to comment on that, that would be great.
And also, Dr. Viner, just to clarify, it's 2 facilities, right, that you're looking for a request for proposal? Is that in Calgary or any city, or where are you looking?
So the RFP is for a facility in Central Zone and a facility in South Zone. Would be two separate facilities. The volume of 1,350 cases for Central Zone is the floor, or the minimal volume. The volume we end up delivering could be higher than that based on need and the capacity of the facility. Similarly for South Zone, that 1,250 is a minimal volume. As Minister Copping said, the focus is on orthopedics, general surgery. We worked with our clinicians, clinical leaders, administrative leaders to identify the procedures that could be done in a chartered surgical facility, freeing up capacity in the hospitals, delivering the most value from a clinical perspective within those 2 zones, and ensuring that we're not going to move any procedures better done in a hospital, to chartered surgical facilities. So this is definitely value add in addition to, and the way we view the capacity in the chartered surgical facilities really as an extension of the overall surgical capacity we have within the zones and within HS overall.
And Colleen, do you have a follow-up today?
No, that's good. Thanks.
try to adjust this here. A question for the Premier. I feel like one of these rock musician guys trying to adjust the microphone. Mine actually, I've learned from yesterday when you made a bet about people to go on topic. I'm actually going to ask you a healthcare question, though it isn't about the announcement, but at least it's healthcare, so I'm moving forward.
We're in a hospital, fair enough.
We're in a hospital, and that's why I thought of the question. What do you say? I know you're not commenting on particulars of candidates or leadership stuff, but one thing lurking in the background of a lot of people's discussions is the issue of Alberta Health Services. How do you react to people who would like to see major changes at Alberta Health Services? Some of them saying Alberta Health Services needs to be gutted. We're talking about at the top level, not the
Sure.
staff. But what do you say to those people who want to make Alberta Health Services, a major shakeup?
Well, as I've said for some time, there needs to be greater accountability. And I can say that the board of AHS is substantially different than the board that this government inherited. And there is a search process for a new president and CEO of Alberta Health Services. The previous CEO's, she departed a year before the end of her contract period. And so we're in the process of a change in the key leadership of Alberta Health Services. Albertans are right to expect accountability. This is an enormous publicly funded organization with huge responsibilities of a life and death nature. There is not a want of resources. It's an organization with, I believe, about a $16 billion budget out of our health budget of some $22 billion. We have one of the most expensive health systems in the country, and Canada has one of the most expensive publicly funded systems in the world. We have one of the highest per capita numbers of doctors and nurses in the country. And so the constraints on healthcare capacity that we experienced during COVID were, for me, in some ways inexplicable. I know there's a general problem in Canada, but the system was not purpose-built and, frankly, did not respond to political direction from government to increase baseline capacity for critical care. Which meant that we, on 2 or 3 occasions, were very, very close from running out of critical care capacity despite the best efforts of the wonderful people that work in the system. So that is why the government is completely focused on increasing capacity. That's the clear direction we've given to the organization, and I'm pleased to see some progress being made. We put out money this spring to staff 50 additional ICU beds, and we've already opened up 32 of those. So progress is being made. When I became premier, we all knew that there were structural problems in the system, but my view was, in terms of the idea of just sort of blowing things up and resetting them, is we've done that so many times in Alberta without any progress. Ralph Klein took 100 local hospital boards, blew them up and merged them into one provincial health system. And after about 8 years, people said, that's not working. There's way too many problems. And so they created a bunch, I think it was 7 regional systems. And after about 6 or 7 years, they said, oh, this isn't working. There's not enough accountability. There's too much waste. Wait times are too long, so they went back to one big provincial system. So I looked at that experience over the past 30 years and said, well, we could, put on a political show here and restructure the whole thing and send everybody running around creating new organizations and new governance structures instead of focusing on actual outcomes. So what we've decided to do is to focus on stick to our knitting, focus on outcomes, as opposed to just replaying the endless cycle of structural changes at AHS, which we've seen for 30 years.
And my supplementary question, Mr. Speaker, is are you you did so much, of course, for the United Conservative Party, the whole idea of the United Conservative Party, going back to that news conference I remember in Calgary years ago. Are you concerned, depending on whatever happens in the next weeks and months prior to the May election next year, are you concerned about the unity of the United Conservative Party? And are you concerned that the NDP could actually win the next election?
Well,
depending on what happens.
Conservatives should always be mindful of that possibility, and they should always realize that unity doesn't happen by accident. It requires ongoing work and effort, and so too does national unity. So I have spent the last several years of my life focused on unity amongst free enterprisers in this province to present a credible mainstream free enterprise alternative to the NDP. And I've spent 30 years in public life defending national unity at the same time. Both of those unities are very important to me.
Thank you, Premier. We'll now move over to the calls. The phones take some calls. Operator, can you please put through our first question?
Dave Kaiser, CTV.
Good morning. This question for both the Premier and Health Minister. It seems your Reside program, which, if I recall right, was hoping to place about 20 doctors a year for 3 years, has only placed one doctor so far in Cold Lake. So I'm wondering why the program isn't working and what you're going to do to try and make good on those goals that you set.
Thanks, Dave. I'll invite Jason to chip in with more details, but I do know I've heard a lot of positive anecdotal reports about more physicians being recruited in rural communities. That it often takes time, but I've been told, for example, that in St. Paul, where they had a significant shortage of physicians a year ago, that several new physicians have been recruited and are now working in and around that community. And I've heard that about a number of other places. As you know, we added I believe it was $80 million to the health budget specifically for rural physician retention and recruitment. And we, I believe, have the most generous incentives for rural physician retention and recruitment in Canada. Just to put that in context, there typically is only about 800 rural physicians, so that's an investment of upwards of $100,000 per physician on top of the incentives that already existed. And we've also added, proactively offered to the Union of Nurses in their collective bargaining dedicated money for rural nurse retention and recruitment. I believe this is also an issue in the ongoing discussions that Minister Copping is having with the Alberta Medical Association. I'll invite him to comment further.
Thanks, Premier, and thanks for your question on the Reside program. The Reside program, as is indicated by the Premier, the intent behind that was to be able new grads to be able to come out to rural Alberta. We've received some feedback on the program, for those who applied for the program, and also from the RPAP, so the organization that looks at our rural programs in terms of how do we get more residents and doctors out there. There will be an announcement coming in regards to changes to the program. We recognize that we haven't got a full uptake on that. So, we're moving very quickly. I can't give you the announcement right now, but it's coming in a matter of a week or two that we're modifying the design of the program because at the end of the day, we need to leverage all of those dollars to be able to get people in. And if you want some more details in regards to the exact numbers, I don't have them at my fingertips right now in terms of how many have been placed to date. Please contact our press secretary, Steve.
And Safe, do you have a follow-up?
Yeah, thanks, Harrison. Looking to follow up with the Premier here. Mr. Premier, a lot of people expected you to be a lame duck Premier, so to speak, while the UCP leadership contest continues. And while that doesn't seem to be the case here, a lot of the recent announcements you have made can easily be overturned by the next leader, or the announcements you've made that require new legislation may simply not happen. So what I'm wondering is it a good idea for you to keep promising Albertans more and more things that you won't personally be here to see through?
Well, Safe, I was very clear in my decision to stay on until a new leader is elected, that I was doing so to keep momentum as Alberta moves forward and to keep our commitments that we were elected on. Just over 3 years ago, this government received the largest democratic mandate in Alberta history, with over 1 million votes for the first time ever cast for a government. And we ran on a very specific platform. And it's my job, my responsibility to deliver on that platform as long as I am Premier. So if somebody else in the future decides that they're not going to implement the platform that the government was elected on, then they'll be accountable to Albertans. But I am responsible for implementing that platform. And part of that platform was the Alberta Surgical Initiative. It was this plan to leverage the innovation and efficiency of the private sector in delivering more surgeries to reduce wait times and give people faster care. So today is a good example of keeping that commitment. Yesterday, I announced the creation of the Premier's Council on Skills. That was a platform commitment to focus on our effort to valorize the trades and experiential learning, apprenticeships, and to say that a trade certificate and a journeyman status is worth every bit as much as a university degree. That's the policy that this government ran on, and we continue to implement that. So we made the difficult decision to temporarily de-index the tax brackets because of the fiscal crisis that we inherited. Our commitment was to get the province's finances back in order and to do that without cutting health care. And that required de-indexation, but we promised Albertans repeatedly, including in this February's budget, to re-index the tax brackets as soon as we could, and hence the commitment that we've kept. So, Safe, I am doing my job, and you know, I was very clear that if I had stepped aside in April, we would have ended up with an interim government, probably with a whole bunch of new ministers learning their files, and then a paralysis in government for several months, and then a new Premier in government being sworn in, which takes a period to transition into action. So the government of Alberta, I think, would largely have been paralyzed for several months. During a critical time as we're emerging from the COVID crisis, while our economy is recovering in a big way, while we have to defend Alberta's interests in the Federation, makes no sense. So I'm doing exactly what I committed to do, which is to continue the momentum and progress, to continue creating jobs, growing our economy, focusing on pipelines and a stronger Alberta.
Thank you. Operator, can you please put through our next call?
Catherine Gurgowski, Alberta Today.
Thanks very much. On the surgical wait times, the health minister had said the target is below 68,000 by the end of the year. I'm wondering how you're preparing for that fall surge of COVID and how that's going to impact surgical wait times.
So thanks for the question. I'll start off, then I'll ask Dr. Viner to supplement. So we do recognize that we're going to get another flu season is going to come in that will impact capacity, as well as potentially another wave of COVID. We are putting plans in place to be able to manage that. But the big approach is increased staffing and increased capacity. The Premier spoke about it in his remarks in terms of the investment of additional $600 million base funding this year. That's another $600 million year after, $1.8 billion over a period of 3 years, on top of the highest amount that we've invested into our system. It's hiring more people. This is attracting more doctors, but also more nurses and other allied health professions. We are continuing to do that to build capacity in the system, and the charge surgical facility is just another way to do that. So we understand that we're going to get another wave. It's going to happen this fall. and it's likely going to be a bad flu season from the initial reports that we're seeing. But we continue to add capacity throughout the system. We have been, throughout, and particularly with the additional funding. You've seen in the, as the Premier spoke to it about ICUs capacity and additional people to be able to provide the surgeries. So that's part of our overall plan to get not only to the 68,000, but a significant impact below that over the next 9 months. But Dr. Viner, if you want to talk to the specific planning that's going on, that would be appreciated.
Thanks, Minister, and thank you for the question. Really important. As was noted, it's about adding capacity and protecting the capacity that we have and that we'll be adding come fall. And we'll do that through measures that we know have worked in the past, promoting vaccination, particularly for patients and people who are more vulnerable to serious health outcomes, our staff and physicians, so that they're able to continue working and aren't sidelined by illness, through rigorous adherence to infection and prevention and control measures, and as noted, through adding surge capacity both inpatient and ICU, so that we can protect our surgical capacity in the early waves. In order to create capacity, it was done, both in Alberta but throughout the world, largely by, or at least in part by moving into surgical capacity. We'll do, absolutely everything we can to protect and maintain that capacity.
I just would like to add a comment, which is I don't necessarily accept the premise of the question that there will be significant additional pressure on the system from a potential fall wave of COVID-19. We don't have a crystal ball, but we do know that the new variants of the disease continue to have less severity with lower levels of hospitalization. Of course, in the summer, we saw what I would characterize as a relatively small wave of the Omicron B5 subvariant here and around the world. We monitored that very closely, but it did not result in significant additional pressure on the healthcare system. We have high levels of vaccination. Many people have also acquired natural immunity from prior infection. And as we watch COVID here and around the world, it appears much like the Spanish flu in 1918 to 1920 to be moving to less and less severe subvariants. Of course, there's always the possibility that things would go in a different direction, but that would be, I think, almost unprecedented in epidemiological history. So we always have contingency plans to address the need for surge capacity, but I don't think we should assume that that's what's going to happen.
Do you have a follow-up today?
I do. Since the Premier's up at the mic, I want to follow up on his answer to Rick Bell about Alberta Health Services not following the political direction of expanding the capacity in the system. It was my understanding that in order to get those initial targets that were outlined at the beginning of the pandemic, that would involve some pretty extreme measures like canceling surgeries and procedures, adding staff that we didn't have, putting beds out in hallways. Can you just elaborate why you think Alberta Health Services did not adequately follow your political direction?
I'll just say we did not have adequate information because at the beginning of the pandemic in March of 2020, we were told that maximum surge capacity for intensive care could be up to 1,060 hospital beds. That number went down, I think, to 470 in November of 2020. And it went down further, and we were informed exactly a year ago this week, as we were approaching the height of the Delta wave, that maximum surge capacity was, I think, 230 ICU beds. So 1/4 of, and that's using all of those strategies you've articulated. We did, sadly, have to postpone many surgeries, as did every province. We did have to take fairly unprecedented and extreme measures, frankly, to push that number, because, as you know, the baseline the baseline ICU capacity for our healthcare system that this government inherited was 173 staffed ICU beds. So we were given a September surprise a year ago that the best the system could do was to stretch from 173 to 230, which now, there are complex reasons for that, but it was, in my view, unacceptable to have decision makers surprised with that radical reduction in stretch capacity at the last minute in a critical moment. And I don't think that would be acceptable in any institution. And so we had to look at every possible means of increasing that surge capacity, and eventually we established a total maximum surge capacity with all of these kinds of strategies you've mentioned of 380 ICU beds. And we capped out at about 335 at the peak of the Delta wave in September of last year. So, you know, all politics aside, decision makers need clear and timely information when you're dealing with a crisis like this. And we simply did not receive that.
All right, folks, we have no other callers on the line, so that wraps things up today. Thank you.